Diocese of San Diego, and our presenters today are going to be Carolyn Wessel and Nathan Packard.
Yeah,
I'm going to give you a brief overview of their bio. Carolyn Wessel, who has been with Catholic Charities for over 7 years, is the Director of Health and Education and Outreach and the Food Resource Center. She also directs the CalFresh and nutrition education programs for Catholic Charities. Catholic Charities has been serving Imperial County since 1974, and speaking will also be Nathan Packard, Program Manager for Health and Education and Outreach. They're also, as I said, recipients of Covered California, and they're going to be talking about what the strategy is to do the outreach and education in Imperial County. So let's give them a round of applause.
Thanks, and thank you, Sylvia, for having us here today. So my 211 friend told me I had to make everybody move. So has everybody heard of Catholic Charities? Yes? Oh, then, sister, we don't need to talk. But as Sylvia said, my name is Caroline Wessel, and this is Nathan Packard. And today we're going to just briefly talk a little bit about Catholic Charities and what they do here in Imperial County, and then our connection with Covered California and what our outreach and education strategy is going to be. For those of you who are not familiar with Catholic Charities, our mission is to witness, enhance, and advocate on behalf of the poor. All of our programs are geared towards service, and whether it would be sheltering or feeding or serving the poor in those manners. Like Sylvia also mentioned, we have been in Imperial County since 1974. We have locations as far as Salton City, Westmoreland, Brawley, Ocotillo, and down in Calexico, and then our main administrative offices in 250 West Orange. We have the House of Hope. For those of you that aren't familiar with the House of Hope, it is an emergency shelter for homeless women. We have Our Lady of Guadalupe Shelter over in Calexico, which is an emergency shelter for homeless men. At our location at 250 West Orange, we do immigrant services. We have the Food Resource Center also at Orange, and then we've also looked to do some rural food distributions where we have taken food and distributed it out to our rural parishes, looking at Salton City, Westmoreland, Imperial, and those neighborhoods. We also have the Senior Nutrition Program, which delivers hot meals to seniors and then also provides a congregate meal program. Catholic Charities, the Diocese of San Diego, has also, over the last 5 years, began a much stronger partnership with Catholic Charities of California. What that has enabled us to do is to take contracts like CalFresh or nutrition education and obesity prevention and use a statewide force and learn from the rest of the state and how they do some of these outreach events. So we've been very successful thus far with CalFresh outreach, doing some pre-screenings, educations, and some application assistance, both on-site at our Catholic Charity sites at 250 West Orange and at some of our rural programs. We've also partnered with Catholic Charities of California to do nutrition education and obesity prevention. Some of the ways we've done this is at the House of Hope. We're starting to teach the women how to shop on a budget, how to look at nutrition. We are teaching the children there how to build a healthy plate and really keep health and nutrition as a focus. We're doing the same thing over at Our Lady of Guadalupe Shelter in Calexico, except for with the men, it's a little bit different as they looked more towards programs like Rethink Your Drink and drinking healthy beverages when they're coming back from work and things like that. We also distribute nutrition education both in our Food Resource Center and our rural food distribution sites. So these two successes have led to our next partnership, which is Covered California. Like 211, we will also be contracted to do outreach and education for Covered California and the education piece. However, in Imperial County, we will be doing it one-on-one in person. So we will have folks stationed here, and that's why I will pass this over to Nathan to talk a little bit more about our specific outreach strategy.
Good morning, my name is Nathan Packard, and I'm going to talk again a little bit about Covered California in general, give a little bit more background, because we haven't had much of that today, and talk more specifically about Catholic Charities and how we're working with Covered California to educate people about the changes in health insurance and to get them registered for benefits. So essentially, Covered California is the state agency that is running the Health Benefits Exchange, which is pretty much just a marketplace through which individuals, families, and small businesses can shop for health insurance plans that are financially affordable for them. And some of the main changes that have happened that are coming are Covered California and the Affordable Care Act is going to require that health insurance companies provide their clients with more accessible health coverage, and yes. And okay, so that now we're going to talk about a little bit more about how Catholic Charities and what we're doing to educate people about health care and help them register for benefits. It's kind of a two-facet program. The first phase is called outreach and education, and so this involves us performing outreach and distributing print materials to the public through group and one-on-one educational sessions. And our target population for this phase are families and individuals between 139 and 400% of the federal poverty line. These individuals qualify for subsidies and tax credits through Covered California along with their health insurance. And our service delivery plan for this phase is we're going to perform group education sessions at Catholic Charities facilities in Imperial County, and faith community events and local parish events. And for example, we will have educational sessions at our Orange Street main office in El Centro. And the next phase of our process is called Certified Enrollment Counseling. This is where we will be assisting clients with both Medi-Cal and Covered California applications. Our target population for this phase are families and individuals below or at or below 400% of the federal poverty line. And again, those below 139% qualify for Medi-Cal, so we'll be assisting them with those applications. And again, those between 139 and 400% of the poverty line will qualify for subsidies and tax credits through Covered California. Our service delivery plan for this phase, we will have our staff who are certified by Covered California, being referred to as certified enrollment counselors, and they will meet one-on-one with clients and at Catholic charity sites in Imperial County and parish outreach events to help them sign up for applications or fill out their applications and get their benefits. To put this all in perspective, I'm going to go through a little bit of a time frame of how this new process is going to work. Come October 1st and extending through March 31st, 2014 is the ramp up and open enrollment period. And during this stage, we at Catholic Charities will be performing outreach and education, really trying to get the word out there, letting people know how easy it is to apply, and letting them know all the benefits that are available to them through Covered California and the Affordable Care Act. And also at this stage, we're going to be helping people with applications. So this open enrollment period extends from October 1st to March 31st. That will be when the time that people can actually sign up for the benefits. Come April 1st and extending through July 31st of 2014, this will be a reinforcement and a special enrollment period. So reinforcement for us at Catholic Charities means more outreach and education, because as people have been saying all day, there's going to be these changes that are happening, and they're going to keep changing. So this reinforcement period is to continue outreach and education to make sure that the public is up to date on all the changes with Covered California and the Affordable Care Act. And the special enrollment refers to individuals who Covered California is referring to it as a qualifying event that occurs in their life, which can range from something like marriage, gaining citizenship, or maybe if they had a health insurance plan that existed before the open enrollment and it terminated after the open enrollment ended, that would qualify them to register for special enrollment, which we would be assisting them with applications again so they can get their medical insurance and Medi-Cal coverage. from July 1st, 2014 to September 30th, 2014. This period will be a preparation period for open enrollment, again, that begins on October 1st of 2014. So during this time, we at Catholic Charities really want to get out there in the community and make sure that people understand that there's another open enrollment period, another chance for them to get their benefits. And then October 1st, 2014 through December 31st and onward is the last phase of open enrollment, and this will be where people can get their benefits. So, in short, we at Catholic Charities are very excited to get involved in this program and get out there, and especially in Imperial County, meet with people one-on-one in both and in group education sessions that we will hold in various locations and frequently. And we hope that we can assist as many people in the public with their healthcare coverage that is available to them coming January 1st. So we thank you for your time, and hopefully this was a little bit shorter than the last one, so we can move on.
We did bring the Covered California brochure. If you're looking for a fairly succinct, some of the changes to the Affordable Care Act, the 10 essential health benefits that all programs are going to be asked to cover, that I think several of the other presenters have referenced, are listed in here. The income guidelines for the subsidy assistance and Medi-Cal are also listed in here, and just some basics. So we'll leave them up here if you're interested.
Thank you.
Okay. Okay, where's my sign-in sheet?
Back to the table.
Who has it?
It's on the table in the back.